Okay, guys, hey, this is Dr. Sean, and this is the 105.19 section, terminology. This is the module 6 or 7, which is reproductive system, and today we're going to go over the preview of the male reproductive system. So we're going to probably do this in 3 parts, 1 part for male, 1 part for female, and 1 part for the kind of the preview for the final. Now, follow along with this because I'm going to be going through the modules and we're going to talk about new terminology and some new diagrams and some new fun stuff that many of you've heard of, but you don't know how to pronounce correctly, or you're not sure exactly where it is, and you're going to know after all of this. It'll be fun. So what was the other thing I was going to say about this? When you guys are turning stuff in, just make sure that you're doing full sentences, and the discussion boards have to have a response. So make sure that you're responding to each other in full sentences and using the proper grammar and stuff, because that's a couple points, and that makes a difference, right? Going back and doing some other stuff, good, but this is kind of the end of class, so the pressure is on. Okay, so let's get started with this one. We're doing male reproductive system at this time. Now, look, I'll go over some of the other stuff. Now, I do have YouTube channels, so make sure and go on YouTube. This is going to be on YouTube, of course. But on YouTube, find the other ones. I'll try to put them somewhere up here, a link to them, but I have a reproductive with drawings and stuff like that. Also, you can watch. It's about 10-15 minutes. This one, I'm not sure how long it's going to be. We're already a minute 36 in. Let's get going. So, you've heard of an Android, right? Not the phone. This is an Android phone. But Android means like man-like, human-like, right? And so andrology is the study of the male reproductive system. Now, androgens are things that generate maleness, for example. And so you have things like testosterone, which is a hormone that the male body and female body both make, but the male body makes it more in the testes, right, after puberty. Okay, starting around 9-10 years old, they start actually developing a little bit of pre-testosterone kind of stuff, and then eventually testosterone gets developed, and it hits a peak in the late teens and early 20s and keeps going up, and then eventually starts falling again. And that's where we have problems like erectile dysfunction and low T, which is called low testosterone, and that can cause all kinds of other weird issues for men, just like menopause can cause problems for women, and that has to do with estrogen, which we'll talk about in the next chapter. So as we look through the thing here, you can follow along with me. I'm on module 1, reproductive system. This is slide 1 of 12, and there's a picture of a guy, Frank, who's has bloody urine. So he's urinating and he's noticing blood, and that's a bad thing. Now, what could that be? Now, if we're looking at just the anybody's system, if anybody has blood. Now, females, when they have some urine and blood, it's not really that big of an emergency, because they're like, well, I could be on my cycle, so that's when that will show up, obviously. Now, for men, it's a totally different thing. If you eat beets, men especially, this is hilarious. So if you have a boyfriend or you have a friend who's a male and they don't know any of this kind of stuff, give them a bunch of beets. Hopefully they eat a bunch of them, and the next morning they will be peeing red. It'll look like blood. They'll freak out, and it'll be fun because you'll know what it is. It's the beet dye coming through the kidneys, down through the ureters and into the bladder, and then eventually out. Now, this guy here in this one talks about a urologist. Anything uro means urinary system, and this is a urogenital system. Okay, so this is talking about urinary system and genitals, which is reproductive. Now, those are connected. For males, there's a little bit difference than females, but not a whole bunch. Here's the main difference between males and females in that respect. In the male, the urethra will go from the bladder into the penis from that area, and it'll go through a gland called the prostate gland. Women, you don't got one. Okay, so females do not have a prostate gland, and the urethra then doesn't go through it, right? And then the urethra in the male goes through the entire length of the penis, which is longer than the urethra for the female. Basically, indoor plumbing for girls and outdoor plumbing for boys. That's how it kind of works. Now, a urologist, doesn't matter if it's male or female, they'll be able to study those things from the urethra back into the bladder and back up into the kidneys. Now, urologist usually is more a little kidney specialist. They deal with bladder issues. Now, you can have different problems with the bladder. You can have kidney stones could cause this hematuria, right? Hema, blood, and urea, urine. So bloody urine is hematuria. Now, if you have pus in your urine, that's going to be called pyluria. If you have glucose, glucoseuria. Got it? Okay. Proteins in there, proteinuria. Now, if you have proteins in there, it could be because you work out. It could be you're eating too many proteins. It could be other disease processes. It could be injury to the kidney itself. If you have glucose in your urine, that's sugar, like a sweet pea. That's diabetes mellitus. Mellitus means, remember, miel means honey, and so mellitus means inflammation that's like sweetness inflammation, basically, is what it's talking about. So that's what we'll see there. So what is the other one too? Pyluria, you have a bladder infection. So worse, it's easier for females to get bladder infections because their urethra is only about this long, right? So maybe, I don't know, something like this, an inch two maybe. And because it goes from the opening, okay, it was called the vestibule, okay, is the opening area, that front area. We'll talk about that in the next section, which is female. But from there to the bladder is a very short distance, so bacteria can ride up inside there and end up hanging out inside the urinary bladder. And once it gets in there, it kind of goes to town if they don't urinate enough, if they're not passing enough water, if their urine isn't acidic enough or something like that. So that's why many times with urinary tract infections, we'll drink cranberry juice. So anyway, let's go back to here. He has blood in his urine, which is hematuria. This doctor will perform a variety of tests and check his overall system. As we get through here, there's two kinds of tissues that we're going to be talking about. Parenchymal, okay, you'll see this in here as you're in section 2, right? Section 2 of the thing. We're going through this together. Okay, and then stromal. Stromal is secondary, means like kind of the stroma is the stuff that's added onto it. The parenchyma is parenchymal is the primary tissue, the main tissue of function. Let's put it that way. Okay. Contrast tissues support the function glands. There's a lot of glands, a lot of nerves in there. There's a lot of ducts. And remember, duct goes from gland to the outside or gland to somewhere, right? As a duct is a little tube. Other male reproductive tissues, there's a lot of them that transport and develop in the male reproductive system. They develop and transport the male sex cells, which have half as much of the gene information, right? The genome, basically. It has half as much as the female. So, I mean, half as much. Males have half and females have half, and you put them together, you get a whole you, right? That's like you have some of your DNA is from mom and some is from dad. We don't know which part. It's just they kind of end up that way. That's called the genome, basically, is the whole list of those things. We talked about that probably in DNA and stuff. So the tissues of the reproductive system, generally on the outside, are called genitals or genitalia. You can have injury to your genitalia. You can have problems with the genitalia. It can be, it has developmental issues too. There's many developmental issues, which you can see in different books. There's hypospadia and, geez, I'm trying to think of what other ones. Just for males, you can have undescended testes. The testes, or what we call the balls, drop down at about 9 months. Baby, little babies have none in their scrotum, which is the sac that holds them. And we'll talk a little bit about that in some of the muscles. Okay, so here we go into here, the genitalia, parenchymal organs known as gonads. Gonads are the primary functional unit of the male reproductive system. They're gonads. They create sperm cells. Okay, in the female, they're called ovaries. Gonads, testes. Okay, now a testy or testes is one testy, two testes. That's right. That's all it is, right? They will make gametes called spermatozoa. Now they go through a whole process inside the testy itself, which is like a little egg-shaped, very segmented piece of tissue. There's a lot of different tissues in there. It should be about 3 degrees lower than the body temperature being 98.6 generally in Fahrenheit. So we want to be about 98, 97, 96, 95, right? 95. And that's why they actually are outside the body, because they create the sperm cells in a cooler environment, okay? One of the things they do with reproductive stuff when people have had, I'm just reading ahead while I'm talking, while people have had reproductive therapies to have kids is they'll tell the male to wear boxer shorts and not the tidy whities, because those hold the testes too close to the body, and they shouldn't have hot tubs and all that kind of stuff. The scrotum, like I said, is a skin covering which has muscle. There's two types of muscle in there. You have the scrotal muscles and another one called the cremaster. The cremaster or cremasteric muscles help lift, and they're kind of like a little thermostat, and as it gets too hot, they loosen and let it go further away, and as it gets too cold, they hug them up, right? That's what they're supposed to do. They're trying to keep that 3-degree difference. Now, it's kind of amazing that they work that way. That's what happens. So as we go from the testes, we're going to follow a sperm cell. So a sperm cell is made in the testy itself. Okay, there's small little bits in there. It comes to a next place called the epididymis. Epididymis is it's not hard. It's kind of a spongy feeling set of tissue along the side of the testy itself. You can see diagrams in here, and then there's a cord called the vas deferens, okay, or sometimes called the prostatic cord, okay, or sometimes called the spermatic cord. It goes all the way from the epididymis all the way back up into the abdomen, loops around down behind the bladder. You can see it on the diagram. It's in light blue. Okay, so this one, which we can see, I'll show you real quick, like you can see right there, that's the diagram I want you guys to be looking at. This is section 3 of 12. Section 1, slide 3 of 12. We'll go through those. We're looking at here, it wants you to label which one is which. Number 1, let's see when there, that's that, we're going to see as that goes from the testy, right, through the epididymis, up the vas deferens to an area which we would call the seminal vesicle. A vesicle, remember, is the same as like a cyst. It's a holding sac, okay? And this stuff, the epididymis is like the launch pad, the ready zone for the sperm cells to get going. And then the seminal vesicle adds some of the supplies to these little guys so that they can get all the way through around the vas deferens into the prostate, where more fluids and mucus and things like that, and sugars and things like that, supplies basically to the sperm can get there. And then it goes all the way out, and there's another one called the Bulbourethral gland. We'll talk about that in a minute. And it goes all the way out, and then eventually, hopefully, gets to the egg inside the female. Okay, so let's go number 3. The ejaculatory duct. Ejaculatory duct is part from the seminal vesicle into the prostate. So the prostate is around the urethra, and then there's another tube that reaches in the back called the ejaculatory duct. Okay, so the sperm's going to come in through that way, and this all closes off so it doesn't go back into the bladder, hopefully, right? And then that's going to add some stuff to it. The prostate is a gland. If it doesn't express its contents, it stagnates and can cause irritation. Okay, this is called prostatitis, or BPH, benign prostatic hypertrophy. Benign means it's not malignant, it's not cancer. Prostatic, prostate. Okay, hypertrophy, hyper means more, right? Trophy means growth. So it grows, it starts to swell. Now that can cause urinary problems like dribbling and frequency problems. They got to get up in the middle of the night. This is for older guys generally. It can happen in younger guys for sure. And the next thing we get to is the bulbourethral gland. The bulbourethral gland is what releases a little bit of very, very alkaline, right? Because it's trying to offset the urine that's going through that tube, right? The urethra of the male. So it's going to release a lot of alkaline stuff, and it's very smooth, so it can help lubricate to get everything out of there. Okay, it's a very like viscous. You can kind of grab it and move it around. It's like not like saliva is not like that, right? It's very thick. Then we get down through so we have the penis, the urethra, they have the glands, which is called, is kind of the end of the penis, and then the covering of that is called the prepuce. The prepuce is what they will say in the book. So you can listen to that, because it'll have you go through the whole thing and read or at least hear the word, and then you have to spell it. So look at those. Puberty, the testes begin to produce in males, of course, because females don't have testes. And that's, remember, the XY chromosome, right? Creates them to do that. We're all basically born as females, and it is the Y chromosome that creates what's called a Wolffian duct, and the ovaries are kind of up in some tissue near where the kidneys are, and then it all starts to migrate down in the embryo as it starts to grow into a fetus. And those, they just kind of slow down and stop, and that means you're a girl, okay? Because that's what the rule, that's what the recipe book says, right? It has the XX chromosome. XX means, okay, stop here. If it's XY, they keep going, keep going, keep going, and they should end up down in the Wolffian duct and create testes. That's a quick and easy way to do that one, right? Now, the spermatozoa, the sperm cells, okay, they go through a process called spermatogenesis. There's a little video you can watch here. It's like a minute, pretty good. You can even look in the bottom of the video. You can change the speed on that. You can change it to 2 or whatever if you're in a hurry. So we have seminiferous tubules, the epididymis, where they mature and are stored until ejaculation. So in the epididymis, remember that there we have the testy, and they have this little, like in the picture back there, it's light blue. It's a little like kind of squishy thing right on the edge of the testy. That's called the epididymis. Now you can get what's called epididymitis. Okay, epididymitis is inflammation of that. Usually it's not a bacterial thing. They generally like to give you antibiotics for it, but it happens because you have reached a certain amount of stimulation, but there was no emission. Emission is the removing of the sperm, right? And the semen is what holds the sperm. Okay. Now, if someone has had a injury to there, whether it's been traumatic injury like being kicked or punched, that can also cause these kind of things. It'll be very sore, and it may even hurt up into the low back, kind of like a kidney feel. It's a very weird kind of feel if you've ever experienced that. If you're a male, if you're a female, I don't know what it feels like to get kicked in the genitals, but it hurts as a guy. Stop everything you're thinking. Semen formation is because of spermatogenesis and ejaculation. Ejaculation is the release of the semen and sperm from the body into the female generally. Okay, we mentioned there were several glands add fluid. Okay, the seminal vesicles, Cowper's glands, or also called Cowper's, are the bulbourethral glands, which is right at the bottom of the penis. Okay, deep inside, right at the base. Okay, it's the one that actually adds stuff before the semen comes through. We call it, people call it sometimes pre-cum. Okay. Sperm fluids form glands, make something called semen. Okay, seminal fluid. Semen is also called seminal fluid. Okay, so it has a bunch of different names. There's a lot of complexity in this with vocabulary, and that can be really a pain for those things. Frank has difficulty. We're going back to Frank. Okay, I'm on slide 7 of this one. Frank has difficulties with urination. Urination problems can be related to structural problems in the penis or urethra. In normal anatomy, as the semen vesicles join the vas deferens, okay, the vas deferens, remember, it goes in through the seminal vesicles, join the vas deferens. So we have the testes, we have the epididymis, and then you have that tube that goes up around the urinary bladder and comes out, into the prostate, right? Because it's right outside. Here's the bladder, and there's the prostate, and here's the urethra going through, and then you have the ejaculatory duct going through there, as we're talking about right here. Normal anatomy, seminal vesicles join the vas deferens. They form the ejaculatory duct, leading to the urethra. The urethra contained within the body or shaft of the penis, also called phallo. Okay, that's the phallus is Greek. Okay, you hear the word phalanx, which is means pointy thing, is what it means. Okay, also we say phalanges. Okay, it means pointy thing. The fingers and toes are called phalanges. Same root word, phallo. Okay. Somewhat bulbous glands penis, that's the end, are called balano. So you have balanitis or balanonephritis, whatever, balano. I can't remember the word. I'll think of it in a second. Birth is surrounded by a fold of skin called the prepuce or foreskin. This skin is sometimes removed in a procedure called circumcision, which is cut, snip, snip. Hopefully they do it when they're younger. There's a lot of controversy over that. Some people are like, don't do it. And some people are like, yeah, you'd have to do it because it causes all these problems. But I mean, we didn't do it all the time, and a lot of places don't do that ever. And it's not like everybody died off because they all got infections or something. That can happen, but they got to learn how to take care of it. Okay, after little kids. At the peak of sexual excitement, okay, which is the stimulation, Ejaculation occurs, which during semen travels from the urethra through the shaft of the body of the penis, ejected through the end of the urethra, it lies within the gland. Okay, that's 12. 7 of 12. 8. Did you catch that? The glands, penis, and penis are related, but not the same. Okay, there's two different kinds of tissue in there. If you look at it closely, the diagram, okay, as it's cut, there's a corpus, I mean body, spongiosum, right, which is spongy looking, right? As you cut it, you look at it, oh, it looks like a sponge. And then there's a corpus cavernosum, which has bigger spaces. They're like caverns, okay? And that's why you see it that way. The word balan, which is the Greek word, like the head of the penis, comes from the root word of acorn. It looks like an acorn, I guess. Male reproductive, so you're going to have another one with the penis. So there you have corpus spongiosum and corpus callosum. It doesn't really identify those, but it does identify this prostate gland and the bulbourethral glands, the urinary bladder, and urethra, of course, like that too. So that's pretty good. And it even has, let's see, I'm going to click the little book thing. Correct phase, blah, blah, blah. Okay, I'll give you a chance to try again. Okay, 10 of 12. Going through the thing. This is speak and spell. So speak and spell will have some words like epididymis, vas deferens. And they pronounce them a little bit different, but just practice them 1 or 2 times. It'll be really funny. You should do it really loud with your speakers, really loud in the house, so that your neighbors can hear you say things like spermatozoa and prostate and stuff like that. But whatever. I mean, those are technical terms. You're going to hear them again. You get over them, so they're not funny anymore. They're always funny. Anyway, male reproductive audio review of male reproductive system. So it goes go through another minute of what's going on in there. Number 12 here. Listen and choose what produces what. Okay. As you go through that, you should be able to do these pretty easily. This is already 20 minutes, man. I can't believe it. Anatomy and physiology, part 1. We kind of talked through that. It'll give you another quiz. Build terms, male reproductive system. So there you go. Threaded case. Phimosis. Phimosis. This is your lesson 1, congenital disorders. Disorders that you're born with, okay? And it'll explain what that is and how it's treated. Okay, so read through that. And there's that hypospadias and epispadias. Hypo, okay, is below. So what happens is the opening of the urethra develops in the wrong place. Should develop at the end of the penis. If it's hypospadia, it's on the bottom. If it's epispadias, it's on the top. Okay, generally those are surgically repaired. Should be pretty easy. Congenital defects, cryptorchidism. Okay, so this is we're talking about the falling or the descending of the testes. This is where we get into that. So we're talking about crypto. Crypto means in a crypt. It's hidden from us. Cryptorchid. Orchid, when you hear orchid, that basically means reproductive parts. Orchids are flowers. Flowers are basically the reproductive organs of the plant. That's what they are. So you're playing when you smell a plant flower, you're smelling the genitals of a plant. That's what you're doing. How does that feel for what, Valentine's Day? You can have aspermia, which is no, you're not making any sperm. Azospermia. Okay, there's oligospermia, temporary or permanent deficiency. Okay, scanty. Oligo means scanty or few. And it goes through more really cool words. Let's see if we have any.
Hypospadias.
Hypospadias. Hypospadias.
Epispadias.
Epispadias. Phimosis or phimosis.
Cryptorchidism.
Cryptorchidism. We talked about that. That's on the inside, right?
Oligospermia.
Oligospermia. Scanty sperm. Not many. They take an ejaculate. Okay, so they take the sample. They look at it under a microscope. If they have to count how many sperm are in there, well, they look at how many are in each section, and they'd be like, "Wow, there's not very many." That's
azoospermia.
No, that would be
oligospermia.
If you see none,
azoospermia.
There we go.
Aspermia.
That's none actually. No sperm.
Anorchism.
Anorchism. You're born without orchids, no flowers. You have no gonads, basically. But congenital disorders. We talked about that. Okay. They go through here. You're going to look at pathological BPH, which we talked about. Hopefully you took notes on that. BPH, benign prostatic hyperplasia. And then you have balanitis. Okay, there we go, balanitis. There it is. Orchitis. Okay, that's inflammation. Vesiculitis, you can have that too. erectile dysfunctions. So also a really good one to see in there, which you may see if you work in emergency departments too, is hydrocele or varicocele. Varicocele was called a bag of worms because you get varicose veins. Remember, those are a failure of the vein valves, and blood kind of like goes through the whole thing and kind of fills it up, and you end up with a lot of really tortuous, which is called, you know, tortuous, like squiggly veins in the scrotal area. Okay, it can be very painful, and sometimes they do surgery, sometimes they don't. Just say live with it, I guess. I don't know. Inflammatory problems, BPH. We talked about that. That's old Frankie. And then you go through and prostatitis. Okay, and then they go through different sexually transmitted diseases. How much fun is that? Gonorrhea. Gonorrhea is a bacteria, okay? And one of the things that happens, men usually see these things very quickly, and sometimes they hide out in females because they have internal plumbing, which we talked about. Herpes simplexes. Herpes is endemic, so there's a lot of people that have it. It's very similar to the herpes simplex 1 and herpes simplex 2. Just depends on where you got it. Okay, and it can be all over the place. It doesn't really cause any other problems. HPV is genital warts. Human papilloma, okay, virus is a virus, so those are two viruses. Syphilis, syphilis is a bacterial infection that can cause problems that then eventually go internally and cause neurological issues and very bad things. You have to treat that one sooner because it'll make you crazy. So other people that we think had syphilis was Adolf Hitler, Al Capone, and maybe some other people like that. Now, syphilis is a weird one because they used to not ever even say the word. They would write sigma in their notes because syphilis became so bad and was actually killing people in the Middle Ages. Okay, so you can go through those. Other ones, there you go, study with Frank, testicular tumors, benign testicular tumors, that's not good. Teratoma, you're going to see that word. Include non-seminal teratoma. Teratoma means like monster. It's a terror, like a teratoma, right? Teratoma is it has a bunch of cells in it that may make hair, they may make eye tissue, and all that kind of stuff. Seminoma, different adenocarcinomas. There we go, malignant. Okay, there we go, Leydig cell. You can look those up. Pretty easy to do. Take your notes. Use your notes when you're taking these quizzes too, right? Nothing wrong with that. Neoplasms, that means cancers. We're at 27 minutes. Come on, man. Let's get through this one real quick. Diagnostic, therapeutic, blah, 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 blah. Terms, oh my gosh, 7. Prostate exam. Prostate exam, digital means finger. Rectal examination. That means you're checking the rectum. If you're doing a digital prostatic exam, you're reaching in and you're reaching anteriorly to feel the prostate. When you do that, it should feel like they have to pee a little bit, and then you can feel the prostate. Same thing like when a OBGYN will reach in and feel the cervix in a female. They'll push down on your belly, right, and feel the cervix, and it should feel, normally it should feel like this. If it's swollen, it feels like this, and if it has cancer, it'll feel like this. So that's the way you're taught when you do those kind of exams. Now you can do blood tests too and all that kind of fun stuff. They'll do different tests, sonography. Okay, you can do some sonography, which is ultrasound on those. Diagnostic procedures, therapeutic interventions, getting married, blah, 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 male reproductive. Looks like that. Come on, tell me it's it. Is that it? 7 of 7, 1 of 10. Oh my gosh, this keeps going on and on and on. Circumcision, orchiplexy, orchidectomy. Orchidectomy, you're taking out the testes. Almost never happens. Hydrocelectomy. Hydrocele means there's like fluid in there. Okay, there's accumulation of fluid in the tunica vaginalis of the testes, different area of the scrotum, and it'll be like boggy and stuff. They may have to get in there and open that up. That's a possibility. Vasectomy, and then you see a little animation, which is really cute. They're no big deal. It's an outpatient procedure. They can do it in about 10 minutes. Basically, it keeps the sperm from going from the epididymis outside, and it gets reabsorbed in the system. It's no big deal. They can also do here. They transurethral resection. They go in through the urethra in a surgical. They put you out for that one, I hope, and they can take out the parts of the what's that called? Thing, prostate. prostatectomy. They might have to take it out. They can do that. They can also put in little tiny like radioactive pellets in there that help, kill the tissue basically. So if it's cancerous, they can get rid of it. Diagnostic procedures. There we go. 10 out of 10. Is this the end? Oh my gosh, it keeps going. These things are long, man. Oh, okay. Your word bank is next. Word shop. Haha. Okay, these are cool. Condition of no living sperm in the semen. Very good. Okay. Look at that. You got to build word bank. Go through and read those. Write them down real quick. Write the ones that you know, and write the ones that you don't know that you know, and then you can go through and do those and get an A on the test. Very simple for that kind of stuff. There we go. It looks like end of case study. Who's this guy? Acute, severe, and unrelenting scrotal pain and swelling, nausea, and vomiting. That's a bad sign, nausea and vomiting. Although he believes he's not engaged in anything considered strenuous. He's performing warm-up exercise, track and field, and examination. Oh, so he had a torsion, probably. So what can happen is the epididymis and all of that stuff can turn, and you get a torsion in there, and that can swell up, and you have big problems. 6-month-old, his testes have not descended. He has been monitored over the next 7 months. As otherwise, okay. They refer him to a urologist to see what happened. Are they coming out or not? Okay. Medical report. Oh, look at that. They have a whole medical report here. That's interesting. Very good. Surgery report for Frank. End of project. Male reproductive. Just going through conclusions. There we go. That's it. So there we go. That's 30 minutes of reproductive stuff for you guys in terminology. Go through, do your homework. I'm going to do a second part for female anatomy and whatnot and terminology, and then we'll do another one for the other stuff. So that was a lot of stuff, guys. I know it's been a ton of stuff. 6 weeks is really quick. It's almost over, but keep up the pressure. I've noticed, because I've looked at the grade books, everybody's doing pretty good. If you haven't, if you're struggling on the struggle bus, I'm going to contact you, and we're going to see if we can help you get through those things. If you're having problems with Canvas, or you're having problems logging in or something like that, make sure you're contacting people and keep things written down. Good luck on those. Talk to you guys on the flip side. We will see you later. Hopefully this is able to work.